Aortic aneurysm is an cardiovascular disease. Look at this picture, shows that aorta and aneurysm. CT findings, look at this. MRI and angiography. Look at this. Detail going on. Introduction. An aortic aneurysm is a serious vascular condition characterized by the abnormal dilatation of aorta, the body's main artery. If left untreated, it can lead to life-threatening complications, most notably rupture or decision. Aneurysms can form in any segments of the aorta, but most commonly occur in the abdominal or thoracic regions. Definition. An aortic aneurysm is defined as a localized enlargement or dilatation of the aorta to more than 1.5 times its normal diameter. It weakens the arterial wall and increases the risk of rupture. Types. 1. Abdominal aortic aneurysm occurs in the part of the aorta that passes through the abdomen. 2. Thoracic aortic aneurysm occurred in the thoracic chest portion of the aorta. 3. Thoraco-abdominal aortic aneurysm involves both the thoracic and abdominal parts of the aorta. 4. Desisting aneurysm, a tear in the inner layers of the aorta causes blood to flow between the layers, creating a false lumen. Causes. 1. Atherosclerosis, the most common cause by a plaque buildup, weakens the aortic wall. 2. Genetic conditions such as Marfan syndrome, Ehlers-Danlos syndrome, and Reisz-Dietrich syndrome. 3. Hypertension, chronic high blood pressure weakens the aorta. 4. Infections. Rare cases include infections like syphilis, and mycotic aneurysms due to fungal infections. 5. Trauma, chest or abdominal injury can lead to aneurysm formation. 6. Inflammatory diseases such as vasculitis, risk factors. 1. Age, more common in individuals over 60 years. 2. Gender, men are at higher risk than women. 3. Family history of aneurysm. 4. Smoking, a major risk factor. 5. Hypertension, high blood pressure. 6. Hyperlipidemia, high cholesterol. 7. Connective tissue disorders. Complications. 1. Aortic rupture, the most severe complication leading to internal bleeding and often death. 2. Aortic dissection, a tear in the aortic wall creating a false lumen where blood can pool. 3. Thromboembolism, formation of blood clots within the aneurysm can lead to embolization. 4. Organ ischemia, reducing blood flow to organs due to the aneurysm affecting surrounding arteries. Pathophysiology. An aneurysm begins when the structural integrity of the aortic wall is compromised due to weakening factors such as inflammation, atherosclerosis, or genetic mutations. This results in dilatation as the tensile strength of the arterial wall diminishes. The tension exerted by the blood flow on the already weakened wall further enlarges the aneurysm, which may eventually rupture if it continues to grow without intervention. The pathophysiology of aortic aneurysm can be broken down step by step. First, initial insult to the aortic wall, structural weakness, inflammation. 2. Degeneration of the aortic wall components, elastic fragmentation, loss of smooth muscle cells, decreased collagen strength. 3. Aortic wall weakening. 4. Dilatation of the aorta, tension and pressure, Lapsus law. 5. Formation of the aneurysm, localized bulging. 6. progression of the aneurysm, continued expansion, thrombus formation. 7. Risk of rupture or decision. Aneurysm rupture, aortic decisions. 8. End stage complications. Massive hemorrhage, organ ischemia. This step-by-step pathophysiological process highlights the progression from the initial weakening of the aortic wall to the life-threatening potential of rupture or decision. Signs and symptoms. 1. Abdominal aortic aneurysm. First symptom, often asymptomatic, pulsating mass in the abdomen, abdominal pack or groin pain, sudden severe pain may indicate impending rupture. 2. Thoracic aortic aneurysm, including chest or back pain, shortness of breath, difficulty swallowing. 3. Aortic decision, sudden sharp chest or back pain, weakness or paralysis in legs. A diagnosis. 1. Physical examination may reveal a pulsated mass, signs of vascular disease. Then imaging diagnosis to ultrasound, commonly used to detect and monitor AAA. 3. CT scan provides detailed imaging of both AAA and TAA. 4. MRI used to detailed images without radiation exposure. 5. Angiography helps visualize the blood flow through the aorta. Nursing diagnosis. 1. Risk for ineffective tissue perfusion related to aneurysm development. 2. Acute pain related to aneurysm expansion or decision. 3. Anxiety related to uncertainty of condition and potential for rupture. 4. Risk for decreased cardiac output related to rupture or decision. 5. Risk for injury related to aneurysm, rupture or surgical intervention. In medical management, 1. Monitoring small aneurysms may be monitored regularly with imaging to track growth. 2. Blood pressure control. Antihypertensive medications such as beta blockers to reduce pressure on the aorta. 3. Smoking cessation and lifestyle modifications, encouraging patients to quit smoking and follow a healthy diet. 4. Surgical repair recommended for aneurysms larger than 5.5 centimeters or those growing rapidly. 5. Endovascular aneurysm repair EVAR, a minimally invasive procedure where a graft is placed inside the aneurysm. 6. Open surgical repair. The aneurysm is replaced with a synthetic graft via open surgery. Nursing management. 1. Preoperative care. Educate patients on surgical options and procedures. B. Monitor vital signs, particularly blood pressure. C. Administrate medications as prescribed antihypertensives. 2. Post-operative care. Monitor for signs of graft leakage. B. Pain management. C. Assess pulse distal to the graft site to check for adequate circulation. D. Promote early ambulation and deep breathing exercises to prevent complications like pneumonia. Treatment. 1. Endovascular repair, the preferred method for many aneurysms, especially for patients at high risk for open surgery. To open repair involves direct surgical intervention to remove the aneurysm and replace it with a graft. 3. Medications, management of hypertension, cholesterol lowering drugs, and antiplatelet therapy. Psychosocial medicine. 1. Anxiety and fear. Many patients experience significant anxiety due to the life-threatening nature of the aortic aneurysm. Psychological support and counseling can help patients cope. 3. Family support. Families should be involved in care discussions, especially concerning surgical decisions and recovery expectations. Prevention. 1. Smoking cessation to control blood pressure and cholesterol levels. 3. Regular monitoring for those with risk factors or family history. 4. Healthy lifestyle. Diet rich in fruits, vegetables and lean proteins with regular physical activity. 5. Screening, especially for older adults, particularly men who have ever smoked. AAA screening. In conclusion, aortic aneurysms are serious vascular conditions that can lead to life-threatening complications like rupture or recession. Early detection, vigilant monitoring, and lifestyle changes are critical in managing smaller aneurysms. Surgical intervention is often required for larger aneurysms or systematic cases. Prevention and regular screening are key to reducing mortality associated with this condition. Thank you. Have a nice day.